Good afternoon. Welcome back here at ECMID TV, brought live to you from our studio here at the Bella Center in Copenhagen, Denmark. I am very glad to introduce my next guest who is with me here in the studio via live stream, which is Dr. Andrea Ammon from the European Center for Disease Prevention and Control, the ECDC. A warm welcome to you, Andrea.
Good afternoon.
Good afternoon. So you're coming to us from Germany, I think, or where are you calling from?
No, I'm working and living in Stockholm, and
In
this is where
Stockholm.
I still am. I will travel tomorrow evening to Copenhagen.
To join us at ECMID.
Yes.
Okay, wonderful. Well, I'm very happy that you took some time to come and have a little chat with us because we're very interested, of course, in your work at the ECDC. If I'm correct, I see that before this you were also quite active within the public health division. You worked at Robert Koch Institute. That's
Yes.
correct. Yeah,
Yes.
and you have been acting as director for the ECDC since 2017.
No, I was acting from 2015 to 17, and since 17 I'm appointed director.
You were appointed director. So could you give us a little insight, or our viewers a little insight on your core activities as director of such an important institution?
Well, I think there is a stark difference between the last 3 years and the time before.
I can imagine.
So, because I mean, as everybody else in this field, during the last 3 years, we mainly worked with COVID-19. But the principal tasks that we did during the pandemic are our core business, which we usually, and we're starting now again, use for covering all infectious diseases. And we just narrowed it down, but the core tasks were the same, and that is collecting data, assessing risks, and disseminating our findings, and providing guidance and technical support to member states at their request. So we do have a training program, and so all of this was converted to serve the pandemic in the past 3 years. But I will maybe focus first on this part, because I mean, that is all I will have been asked to do on Monday morning, together with 3 colleagues from actually around the world, where there's a session on measuring the changing threat of COVID-19 from 4 continents. So it's the Asian, the North American, the African, and from my side, the European perspective on what has occupied us during the past 3 years. I think this is a very, very interesting occasion to bring all this experience together, because what I think the audience will see is that although the pandemic unfolded in different ways, different times, but the principal issues were all the same.
Yeah. Which were the key issues in your opinion, in all the 4 different regions or continents?
Well, it was a new virus, so we all had to learn what does this mean. And I think everywhere it was underestimated at the beginning. Yeah. And I mean, it very quickly, within 2-3 months, it unfolded in the whole dimension. But until then, we always tried or we hoped that it would be containable. Yeah. And as we all know from today, that was very difficult, because we didn't have any vaccine at that time. We didn't have drugs to combat. And we had to resort actually to measures that haven't been used in public health at that scale and for that duration At least not in my lifetime, and I don't think in the lifetime of anybody who was actually working with that.
Yeah. So
So, I mean,
there were a lot of
lockdowns and so
learnings
forth.
that can be shared from those past couple of years. But I can imagine there's still a lot of learnings now that the situation has tilted completely the other direction, and we're somehow all managing and living with COVID-19. Is that something that will be focused on as well in that session tomorrow?
Yes, I think it is. It will be, at least from my side, it will be a big part because for us, that is what is occupying us right now, that we
Yeah.
translate all these learnings into actions, how to make sure that the next time this something like this occurs, we are in better shape.
And I can imagine such learnings are also applicable to other viral threats or bacterial threats or disease, infectious disease threats. Is that true or?
Yeah, I think the what has to be done, this preparedness that everybody is talking
Mm,
about right now, can be generic. There are certain elements that apply in all of these crises. The collaboration between sectors, the surge capacity in the health sector that is necessary, the primary strengthening of the local level. I mean, all these, the communication chains, all these are really unspecific from any pathogen. And then there are, of course, elements that vary depending on what kind of pathogens you have in mind, whether it's an airborne pathogen, a waterborne pathogen, or so forth. So I think, but largely the investments that have to be done are generic. And that, I think, is a good selling point, because you can say, well, it's not just this tiny part that you're preparing for, it's in general, you're better off.
yeah, yeah. And so, yeah, it will increase also the success factor in order to really get into concrete plans for the future,
Yes.
probably. Yeah. So now that is COVID-19 still your main focus with your work within the ECDC, or do you feel a shift there happening as well towards other infectious
Yeah, I mean,
diseases?
it does occupy a large part still, because, I mean, while it is transitioning from the pandemic to a more endemic phase, there are still elements that we know about other pathogens where we are not yet sure for COVID-19, like the seasonality and so forth, and the speed, how the changes in the virus will occur.
Yeah.
So that is something that we still have to get more experience with. But it is true, we are trying to channel it into a more structured approach, not this ad hoc work that we have used in the past 3 years,
So more
because the virus
anticipation
has surprised.
also, more
Pardon me?
anticipation probably also.
Yes,
Yeah.
of course. I mean, part of the whole preparedness is
Yeah.
to have a better early detection system,
Yeah.
I mean, you cannot prevent this, but that at least you can detect it as early as possible. So, for instance, part of this is that we have rolled out to all member states with considerable support by financial support from the Commission, grants for building infrastructure in whole genome sequencing, which is now, of course, focused on recognizing the SARS-CoV-2 variants,
Yeah.
but of course can serve any other pathogen as
Yeah.
well.
Yeah. So what is your view for the near future? What do you think? Where are we going?
Well, I mean, because you mentioned the other areas that we have to pick up. I mean, we have seen that there is a lot of unfinished business in terms of antimicrobial resistance, in
Yeah.
terms of all the diseases that are related to the Sustainable Development Goals, like tuberculosis, HIV, hepatitis, and the pandemic had quite an impact on the regular vaccination programs.
Yeah.
So in many countries, there are now 3 cohorts, age cohorts of children optimally vaccinated. So we have to really take stock where are the deficits and then really work hard to fill these.
Yeah. And is it difficult to do that on a European level? Because there, I mean, we are a European Union, but there are many differences, I believe, especially if you look at infectious diseases or vaccine programs across various borders. How is your experience with that?
The capacity of member states in terms of public health is, of course, different. And subsequently, also the deficits are not equally distributed. But we have now, after 18 years of our existence, a good network with colleagues in the member states. And I'm now also traveling to many of the member states to offer our support, both in mapping the gaps, but also then support in filling these gaps.
Yeah, yeah.
So I think that there is a two-pronged approach. One is that we, of course, do this individually with each country, but on the other, we will see that there are issues that concern more than one country, where we can group countries together and help them also to learn from each other.
Yeah, yeah, that's excellent. I'd like to zoom in a little bit on ECCMID 2023. You just mentioned that you'd be arriving tomorrow, where you will be giving one of these lectures together with three colleagues. What does this year's ECCMID offer you in your work? What are you coming to get here?
Well, I mean, if I could choose as I like, I would, of course, have stayed the whole period, because there are many interesting elements. But since I'm in the position I am, this is not possible. So I will probably not be able to attend many of the very, very interesting sessions. For instance, the session on structural determinants of health and how to tackle health inequities is a big issue that also concerns our work, as we just discussed. Also expanding the global access to diagnostics and therapeutics, I think, is also, we have seen how difficult it was during the past 3 years. So I think also here changes have to occur. So I will not be able to go to all these sessions. However, 11 ECDC colleagues will attend in various functions as chairs, as speakers. And we will have an info stand where we have, for the first time, a new concept where we try to be more interactive, where we also hope that we can share a bit from our world with the ECCMID participants.
That's what it's all about, right? Bringing the science, but also getting the experience and the interactivity back, which is also wonderful that you took the time to come here with us in the ECCMID TV studio. I'd like to thank you so much for your time and giving a little insight into your work and your focus and field of expertise at the moment. So thank you very much, Andrea, for taking the time and being here with us. And I wish you a very excellent ECCMID 2023 when you arrive here tomorrow. For our viewers, thank you. For our viewers, we will be back tomorrow at the clock of 9 o'clock. So we hope to see you back then. We have many more interesting interviews set up for you. And of course, at noon, again, our Lucky Wheel of Fortune. So hope to see you again back tomorrow on Sunday here at ECCMID TV. Bye.